spectacular is that the most important leadership choices he's made in his career in life, he said, we're learning to rely on other people and then helping them and coaching them. That really kind of has been central to his ability to have impact. We're going to hear from some of the other answers, so please do write your answers to one or more of these questions into the chat. And I just want to thank Micah for a delightful 3 minutes that we spent together. I'm going to shift now and I'm going to talk a little bit about a second model that I think is at the heart of impact and change, and I would say an extraordinary living, both in our career and in our lives. So every day we have this opportunity to kind of decide how we're going to try to make an impact on the world. How are we going to add value? How are we going to make value go up as we progress forward in time as individuals and as leaders? And I would say that when I was in school, in college, Montana State University, and when I began work in the workforce in the federal government, I was routinely sort of taught to commit to the practical, to the doable, which often was incremental change represented by the red box here. But even as I did this, I knew that I wanted to see something better, and I sometimes encountered something better, people who had been able to achieve results that were much, much higher in the very field that I was working in. And over time, I have become an advocate for choosing those better things that we can see are possible, even if we don't know how they're possible for us yet, but choosing to commit to those bolder aims. And then pursuing an emergent strategy. And you see the title of this slide. The title of this slide is something I've created over a period of decades and changed. So when I say emergent strategy, like when you choose the bold aim in work and in life, that means you have to do certain things. You have to stand for them continuously and not release them, stand for them, to enroll others. And when I say stand for them, I mean publicly, to enroll others, because this is what it means to rely on others. Kind of like Micah said in the breakout session, like you don't achieve bold aims alone. You do this with other people, to persist, to learn, and then to rapidly apply that learning to the evolution of your work, whatever it is, and to do that fast. Like this is at the heart of what it means to achieve bold aims. And we can do it. We can do it together. And all of us know of examples of what this looks like. I think one of the best ones in my own life was the example of the moonshot. When President Kennedy said that we're going to commit ourselves in this nation to putting a man on the moon and returning him safely to Earth before this decade is out, that was a bold aim, never been done before. Technology did not exist to make it happen at that time. And through trial and learning and persistence and standing for it and sticking with it, we got there. We met President Kennedy's deadline. That's what I'm talking about. That's what it means to achieve bold aims. Kind of, that's what the business of an emergent strategy is all about. Another example.
Dennis, I'm sorry to interrupt you. Your slide is on the first one. Could you advance it to the slide you're on now? We're seeing your first title slide right now.
Oh my goodness. Well, thank you for interrupting. So I'm seeing a different screen then. So I think
what happens is when we come back from the breakout room, we have to reshare because that connection is possibly lost.
Yes.
Sorry about that.
Yeah, apologies.
Thank you. Yeah. Well, thank you for interrupting, Stephen. And let me try to share my screen again. I will say that I did share it when I came back, but perhaps,
yeah, it is oddly it got stuck on the first slide. I'm not sure why.
Oh, it did. Okay, yeah. I'm glad you interrupted me, and I was rattling on at a pretty good clip.
20.
Okay. All right. So do you see the?
Yes.
All right. Okay, so what I'm going to do, just for the benefit of the audience then, is these are the slides I covered. This question of what's the value I'm going to contribute from day to day. The business of being taught to commit to the practical, the red box, when kind of the blue cross is available to us. I'm getting a little bit of background noise, Stephen, so if someone could be muted, I think we have an unmuted line that's got some background.
Okay, let's please mute everybody that's not on the call, and maybe our directors can mute. Thank you.
Yeah, there we go. Yeah, good. And the emergent strategy, what it looks like to stand for, enroll others, persist, learn, evolve. This is what a collaborative looks like, that up and down. It's not the even that we would hope for, and it's not always up. What happens when a nation commits itself to these aims and sticks to it? Which is quite extraordinary. Now, I've had this experience in my own career over and over. When Don Berwick was the administrator of CMS and Kathleen Sebelius was our secretary, they committed to the two bold aims you see here, the 40% reduction in preventable hospital-acquired condition This isn't a 2% reduction or a 4% reduction or a 5% reduction. It's a 40% reduction. This is a bold aim, and to do it in 4 years. I was put in charge of this effort, and I reported to the secretary, the deputy secretary, the chief of staff, and the heads of all the agencies, CDC, CMS, HRSA, every week on our progress. It was an extraordinary leadership opportunity, I'll say that, but it was challenging. But I will also share that it worked. You know, these are the results then, 4 years later, a 39% reduction. So we didn't hit the goal. 87,000 lives saved, 19.8 billion in cost savings, 2.1 million fewer harms. We can do this. You can do this with the California Right Meds Collaborative. The goals you set for yourself, you can achieve, but it's not going to be easy, but you can do it. And the beauty of it is it's proven. That was the reason we set a 40% reduction goal, because we had seen some hospitals that had done it. So we know these things are possible. They're not pie in the sky, but they're not easy, but you can do it. That's the beauty of the collaborative methodology that you're anchored in here. Now, I also said that you can do these things in life, all right? And I'll give you a quick example of what it looks like in life. So back in about 2015 or so, my family and I have 3 kids. My wife and I took our kids to the movies, and we went to see a movie called The Way, which starred Martin Sheen. And it was a movie about a widowed father who lost his only son. So he went from a family of three to himself. And he wound up walking what's called the Camino de Santiago. This is a pilgrimage that starts in France, and it's 500 miles, 790 kilometers. It terminates at Santiago de Compostela in Spain, which is a cathedral that holds the remains of the Apostle St. James the Elder. He wound up on that walk, and my family and I decided in 2017 that we were going to do it. And I thought it was just going to be my wife and I, because the kids didn't seem that interested. But as it turned out, all 3 of them ultimately said they wanted to do it. So my wife and I left from Saint-Jean-Pied-de-Port. That's where you see the little blue dot on the right-hand side. And we trekked across Spain, 790 kilometers, about 500 miles. My youngest daughter, Margot, 17, joined us together with Grant, my middle son. He was 19 at the time, in Lyon. And they did the last 250 miles with us. And my oldest daughter, Tess, 22, joined us at Sarria for the last 5 days, or about the last 120 kilometers. It was an extraordinary experience for my wife and I, and for our family. And it wasn't easy. You know, I thought, how hard could it be? You know, like, people have been doing this since the time of Charlemagne, right? But putting a backpack on and marching 500 miles in 34 days, rain or shine, wind, whatever, you know, that's the way pilgrimages are. Staying in hostels, it turned out to be kind of challenging. I'll never forget, you know, this is a marriage encounter, right? So, like, if you want a marriage encounter, like, this is 34 days, 24/7 with your spouse. This is a marriage encounter, all right? My son, we were on about the 3rd day after he joined us, kind of halfway along. He said, Dad, he says, you know, most families, he said, this is our first backpacking trip. We've never done it as a family before, right? And I was like, all right. You know, I'd been going to REI with everybody, bought 5 of these kind of good quality backpacks and water bladders. And, you know, I mean, it seemed like every time I turned around, I was spending another $300 on equipment. I said, yeah, this is our first, it won't be our last. We're going to keep using these. And my son, he says, you know, I think most families would have started with a long weekend, Dad, not a 500-mile trek. And I thought, you know, there's some truth to that. But that's what a bold aim looks like in life, right? And when we arrived together as a family at the cathedral and lay down on the plaza in front of us as a family, it was one of the most, you know, the whole thing was one of the most rewarding experiences our family ever had. And none of us would trade it for anything, having completed it. I had to report back to my unit at CMS, you know, 120 doctors, nurses, pharmacists, and other clinicians, and some administrators. And they wanted me to share my PDSAs that I was doing in quality improvement, right? That's why I could use the government phone to communicate back. And my special assistant, so I'd send pictures and little PDSAs, right? And she said, you know, you've sent me 7 PDSAs, Dennis, and the word blister appears 15 times in 7 PDSAs. So blister prevention is a big part of walking the Camino de Santiago. Now I'm going to shift here. This is the last model I want to share with you. We've talked about bold aims. We've talked about leadership as a self-accountability, leadership as a choice. I've got about 3 more slides I want to share with you. And this next one is quite powerful. And the idea here is that all leadership, so when we make this choice, regardless of our role, this leadership choice, it turns out that leadership happens through language, right? Like, I grew up on a ranch in southeastern Montana. I used to have to fix fence in the summer. That wasn't leadership. That was fixing fence. When I worked at CMS and led a unit of 120 people, all of my work all of my leadership work, which was about 90% of how I spent my day, was through language. So you got to get conscious of your words. And there are speech acts that we make as leaders that move us forward, but there also are speech acts that we make as leaders that move us backwards. And we need to get conscious about those things. We need to get conscious about those things, right? And I'm going to help you do that. And it's not complicated. So what's a leadership speech act that moves you forward? Well, it turns out it's a pretty short list, but it's a powerful one. Assertions, declarations, requests and offers. And by the way, requests and offers lead to something else. They lead to commitments. They were on Stephen's slide earlier. Those are leadership acts. When you make requests and offers, you're causing action in the world. You know, if somebody takes you up on your request or your offer, the world's going to turn. If 133 people on this call decide to take Stephen up on some of his requests and offers, the world will turn, right? Acknowledgements, that's thanking people, for instance. Yes, and trying whenever you can to say yes to the other party, and then to build on their thing, to add to their thing, whatever it happens to be. And effective questions, which is something else that, well, the questions we had in the breakout, those were effective questions. I'm going to give you a couple more to think about throughout the day. Stephen anchored this whole learning session in an effective question, right? Those are leadership speech acts. Now, I would say almost the only thing more powerful than knowing what leadership speech act is knowing what it isn't, because we inadvertently use things every day that are not leadership speech acts that will take you backwards, right? So what do they look like? Well, they look like this: complaints, gossip, worries, frets, ineffective questions, excuses, blame. When you find yourself doing these things, and we all do them, I do them, I've probably done it 3 times a day, right? But I'm more conscious of it, right? And I know the effects of it. And I know that from a leadership standpoint, when I do these things, they take you back. When I do these other things, they take you forward. These things take you forward. These things take you back. Get conscious of these things. It'll make all the difference in your leadership. And when I say leadership, I'm not talking about a role. I'm not talking about being the CMO or the CEO or something. I'm talking about your choices, your own self-accountability as leaders. That's what makes the world turn. That's what makes your work better. That's what will cause this collaborative to succeed. And it's what will cause your life to be better too. But that's the other beautiful thing about all of these models, is that they work everywhere. So I'm going to leave these 3 questions for you. We're not going to answer them at this time. We don't have the time. I think we are almost exactly on time. I know I need to end at 12:55 here. But I want you to be thinking about these questions going forward. What are your reactions and insights about leadership speech acts? What are your experiences with using bold aims to drive systems and results? And what bold aims are you committing to now in your work and your life? Like, be thinking about these things throughout the day. I want to pause here and just check in with Connie. And I think we have another member of the team, Connie and well,
Jessica.
Jessica, there we go. To see
Yes,
if
and
yeah, go ahead.
And we've been looking at the chat. It's really hard to narrow, but I'm going to try my best. We have a comment from Ramesh who said, we have made a choice to invest into our CMM program without expecting any returns from payers. Just trying to create value. Our efforts are finally coming to fruition. And then I'll consolidate what Steve and Raina's group, as well as Sun, Minko, and Jessica's group said. There was a lot of transitioning to buying an independent pharmacy in those conversations, and the hard work, having no business experience, and the sincerity that they're putting into it. They said it's hard, but learned leadership lessons that otherwise would never have been known.
Excellent. Those are great comments. There's so much wisdom in this group, so much talent, so much experience, so much expertise. I just want to urge you to take advantage of the opportunity that's being presented to you here. I'll just say to you, Stephen, I hadn't mentioned this to you before, but on Friday I met with Peter Lee. Peter Lee is the executive director of Covered California, and it was regarding a different topic, but I couldn't not talk about you and about this collaborative, on the phone or on the Zoom with Peter Lee. And so I shared with him what you're doing, and he is very interested in talking with you. Mentioned that, LA Care Health Plan is obviously part of Covered California, but he's very excited to talk with you about this work, about your results, but also about your experience and capabilities in large-scale change. I'm going to make that connection tomorrow for you and Peter Lee on that front. And then this is my closing request. I have 4 of them for you. The first, I'm an advocate for bold aims, and it's not easy work, but I want to encourage you to choose to make and stand for bold aims on this work of improving the health of your patients with chronic disease, and to get paid for it. It's the right thing to do, and it will align you with the future of healthcare in powerful ways. And once you do it here, we'll do it throughout all of California and throughout the nation. That's the other possibility. Intentionally use these leadership speech acts to drive progress, results, and teamwork. Lean in on the opportunity of this collaborative. And then the other is, this comes from my background, kind of those 8 years in kindergarten, so kind of 8.5, I guess, in that Fertile Prairie Country School with those other students. 9 at the fewest, 15 at the most, as people come and go, you know, the number changes. But I learned that the way you really learn is by teaching others. And so I want to invite everybody that had an opportunity to spend time with us this morning to share these concepts with someone else, ideally in the next 24 hours. The slides will be available for you to do that, but my request would be, give this a shot. Go home and share it with your spouse or one of your kids or your team at work. It will help to kind of put these things, sort of lock them in for you. They're powerful models, and they've made my life better and my work better, and I know they can for you too. So I'm gonna stop there and send it back to you, Stephen.
Wow, Dennis, thank you so much. You know, I've heard different versions of this before. This is, it gets better every time. And I hope all of you understand why we had Dennis Wagner kick off our meeting today. I don't think anyone frames not only how you transform healthcare, make big changes, but has a track record of dramatic improvement across this nation. So I want to thank Dennis for his public service, for his leadership, for his bold leadership, and for giving us a challenge. I think he's laid it out for us. Not only did he give us a challenge just now, he just made a request, offer, and commitment, probably in a minute at the very end. And you know, I want to thank him for connecting us to Cover California. We are in conversation with him. This is fantastic to be able to meet with Peter Lee. So thank you, Dennis, for all that you do for us, all that in your previous role and now, and all the best to you. Thank you for framing our morning. So we're going to move on to our next keynote speaker. It's Dr. Jessica Nunez de Ybarra. She is board certified in public health and general preventative medicine. She serves as the chronic disease branch chief for the California Department of Public Health, as a principal investigator for, conservatively, several federal grants. I can't even count how many she's involved with now. In 2014, in the CDCB, she and a multidisciplinary team wrote the California Wellness Plan, which is how we eventually got connected, which is the state's chronic disease prevention and health promotion plan, a very detailed roadmap for CDPH and its partners to promote health, eliminate preventable chronic disease, and promote health equity. Since 2015, she served as a member on the California Medical Association's Council on Science and Public Health. Jessica currently worked in CDPH's Division of Communicable Disease Control, facilitating internal public health communications, training, and preparedness activities in addressing the emerging infectious public health threats. So she's very well prepared to deal with COVID and related issues. She has established and oversaw the CDPH Lab Directors Training Program, serves as a volunteer assistant clinical professor at UC Davis School of Medicine, Department of Public Health and Sciences. And she also serves as president of the Sacramento Latino Medical Association. Personally, I am just in awe of this leader. She is tireless, committed to reducing health disparities, making sure patients get the right care that they need. I am so inspired by this leader in our state, and we're so grateful, and we should be appreciative of the fact that she's here in California leading CDPH. So Jessica, I'm going to hand this over to you. Thank you for joining us today.
Thank you, everyone. It's a privilege to be here. I really want to thank you. I want to thank Dennis. Everything stated so far, my heart is full. I will do my best this morning to be brief because the work that lay ahead is so important, and you're all very astute at the work ahead. So I have no conflicts of interest to report. The disclaimer is that these are my own opinion and views, that I intend to work with you all today on one thing. How can we collaborate together? It's so critical. This is my request and offer. Please continue to work with me and the state of California Chronic Disease Control Branch. I believe we really will be able to save lives. And let me provide you a quick frame. In chronic disease, prior to even COVID, we understood that Californians die from chronic disease. Many have multiple, and these impact their quality of life, especially in an environment of increasing medical costs. We understood even before COVID that not all Californians have the same opportunities for a healthy life. We put it in a report with all the data. I want to share with you that we have a window of opportunity right now. COVID, this coronavirus disease from 2019, has provided a tremendous window of opportunity. We understand even now, as we have this novel, severe, acute respiratory coronavirus 2 in our lives, it has caused, as you are all well aware, a worldwide, sudden, and substantial increase in hospitalizations for pneumonia with multi-organ disease and death. I want to share with you something to give you a hold on what I think about every day. What I know right now in the state of California is that 1 in 900 persons aged 18 through 29 years old will die if they contract coronavirus, and that to me is scary. It's even scarier to know that if 1 in 34 people between 50 and 64 get COVID, again, 1 will die. 1 in 3 will die if they get COVID and are 85 years and older. So it's a broad range. Age is a predictor of the severity and the disability and the death. I unfortunately am not here to go into the nuance of COVID, but I can assure you that we have at the California Department of Public Health the latest information and current facts. After this meeting, I will send the most updated data to Stephen to share with the group. I think it's really important that you know how right now, again, a disproportionate number of those disabled, affected in the hospital and dead are Latinx and minority community members. So I am asking now all providers to think about mechanisms to actively identify high-risk patients to seek routine medical care, including prevention interventions. The fact that in this poll at the beginning of the meeting, many of you stated that you did not have a mechanism for referral to CMM, well, I'm going to work with you on that. The other concern that many of you had, that you didn't have access to health information exchange or electronic health records for the clients, we're going to work on that. That is a problem. And I really feel this focus will allow us to not only respond to this current unprecedented pressure on each of you as health providers, but on the state and the nation and the world. We really depend on you on the front lines every day. So let me tell you just a little bit about me in public health right now. I know many of you've heard from me before, and I always refer to the If poem. I feel it's Kipling somehow really understood the work of someone in public health in our current day. He describes, if you can keep your head when all about you are losing theirs and blaming it on you, if you can trust yourself when all men doubt you but make allowance for their doubting too, again, how do we get this work done in this pandemic? How do we do primary, secondary, and tertiary prevention? How do we promote healthy lifestyle so people don't get chronic disease? How do we promote secondary prevention to encourage people to get screening so they know if they actually have diabetes or high blood pressure? How do we get those that have those diseases into your services for comprehensive medication management so that if they have those conditions, they stay healthy? That's tertiary prevention. I'm working in all those spheres trying to partner to prevent and optimally manage chronic disease across all those prevention strategies. I have this here because I want you to know where I hone in. I hone in this way across these numerous programs and initiatives. And you say to yourself, probably looking at this list, Jessica, how are you able to single-handedly oversee the Alzheimer's disease program with all the research grants, the new local health department pilots we have, the Healthy Brain Initiative, clinical center services with the universities, including the University of Southern California and others in your region, to confront Alzheimer's disease? How do I work with UC Merced on the farm worker health study that's innovative and happening now with State General Fund? We're very fortunate to have. How do I work with heart disease, stroke, and diabetes prevention across a block-funded federal program focusing on cardiovascular disease prevention program, the stroke registry for the state, Prevention Forward, looking at blood pressure and diabetes, the newly acquired again Wise Woman program for women? How do I work managing the block grant that comes to California? How do I work with entities that are trying to improve sickle cell care in networks across the state for adults? Children are already handled, but not adults. And how do I then also train the next workforce? I'm the designated institutional official for preventive medicine residency program at the state of California. We also are training future epidemiologists. Well, right now, my programs and initiatives with limited team members and partnerships are kind of central in thinking about the master plan for aging at the state of California. The California Department of Aging is really spearheading that effort. And the governor's task force for Alzheimer's preparedness and prevention will be finalizing their documentation and recommendations back to the governor basically in December, so in a couple months. So in all this work, I have honed in on cardiovascular disease moving forward. And you think to yourself, well, gosh, you know, what is the role of public health? Well, it's what we all do together to make sure people are healthy. And, you know, it's a lot of different interests. But what I can tell you is that we're very proud of pharmacists. One piece that comes to mind very clearly in my mind is after recent rioting in the Sacramento region where I live, I went to Rite Aid and the windows in the pharmacy clinic had been knocked out and there were boards there. The whole place had been ransacked. And the day I entered, they were still picking up glass and cleaning up the store. And there was a pharmacist in the back with her mask on, working by herself because people were afraid. But that, to me, I almost cried. I wanted to take a picture, but I thought you all probably have enough post-traumatic stress from your situation and what you're dealing with being here on a Sunday despite all the list of pressures that are listed there. So what I decided is during this point is to run a poll to ask you so that we can see together what you are able to do, what your successes have been. And let me hand it now to Diane to share that poll.
It's actually Marielle right now. Yeah.
So if you all can look at, check all those that apply, I want everybody to see what you have been able to do despite these challenges. Moreover, I will take this list back to me as we do work at the state and really showcase what all of you are doing as part of your collaborative. Okay. So I will leave the results of that poll for Stephen and Diane to share at the close of my presentation. And just so you know, I'm rushing through so we can get back on schedule and so that we can talk amongst each other and really keep the energy going this morning. There's going to be great presentations from Dr. Kuo that follows me. He's going to go into specifics of cardiovascular disease, mechanisms that you all can be using in your work. I wanted to share with you this as well, health equity. There's a lot of material, and I'll also share additional resources with Stephen. But I wanted to share with you the isms that we're up against, including racism, are really a problem for this country as we try to think about creating a dialogue and a consideration. The information that I will share with you includes the fact that racism is not simple. There are 4 types, and I share that with you, and I'm just going to brush upon them quickly so that you have a frame for why it's going to be hard to confront racism in this country. There are 2 types that are at kind of an organizational level. So institutional racism, which you've heard, where policies are counterproductive to appropriate, treatment of people. The second type is social constructs that implore the idealization of certain hierarchies. So for instance, when you use the term, or people use the term colorism, so for instance, the cultural norm, or in some societies and circles, that light skin is of more value, that's a social cultural type of racism. Now, think about what it will take to change those types of racism. And then the last 2 are more on the individual level. Self-hate, people that hear and feel and live in these racist contexts and then believe and think of themselves in a less worthy way. And then finally, how that boils into confrontations between people, how people then use racist slurs or hurt and attack each other. If you think of those 4 types of racism, you realize what a heavy lift we have and why each of you is needed to work on this, to eliminate and think about the future way we will have more equitable distribution of resources and health. And then next, let's see, okay, so this is really the slide that I want to spend some time on, namely to give you all ideas as we're moving through the day. I want to share with you at the introduction, Stephen mentioned the California Wellness Plan. As part of that effort, we had 4 goal strategies, and one of them was to embrace comprehensive medication management in the community clinical linkages, really assuring great health systems. And I've been working with Stephen and many others in the pharmacy community, leaders in pharmacy, for years now, and I couldn't be prouder. So here are some opportunities in 2021, which is the current fiscal year we're in. The state of California thinks in terms of fiscal year. I apologize, versus calendar year. So right now, I'm looking to partner with any one of you on the line to improve health outcomes and promote health equity. So how are we going to collaborate together for cardiovascular disease prevention in California? Well, this is what I know. Together we can support delivery of prevention services to optimize healthy communities. You're doing that now by this meeting. You know, comprehensive medication management and more collaborative practice agreements is the way to go. I really and truly believe that. Let's work with each other, and this collaborative really is making that a possibility. It's operationalizing that, finding the justification. You've heard about the conversations with Covered California and others, and we're very excited about that, and we couldn't do it without each and every one of you. So one of the things our programs are doing at the California Department of Public Health includes various webinars on lifestyle modification and referral, and we'll do better at creating clarity on how to refer to you for CMM and others throughout the state, and lifting up. The other piece is self-measured blood pressure monitoring that is delivered in such a way that it will be reimbursed. So in other words, patients won't necessarily be writing their pressures down and submitting it to the physician, because that kind of communication or measuring won't count for reimbursement. But the measurings, or when the measures go directly into the EHR from their equipment, that's the kind we're thinking about. All right, so then other bullets that we want to consider. Connecting community programs to clinical services. Again, we're really looking about community health workers, the inclusion of others, the third one down, track and share chronic disease data. One of the really innovative considerations I have for hospitalized acute stroke patients is working in San Bernardino, Riverside, LA, about California Stroke Registry coordinators collecting information on discharge of their stroke patients and possibly referring them to CMM in their post-hospitalization period. You all would then take care of them, check in on them, make sure their blood pressure control is underway, that they understand their medications upon discharge, ask a few questions, get that information back to the stroke coordinator. These are things we're going to pilot this current year, and I'm going to be meeting with Stephen in the coming weeks, probably October, and others. So I'm alerting you that this is underway, and that if you're asked to be part of this, I hope you will. We're setting all the contracts right now for some of that. The funding we have is minimal. The other thing I want to share with you is the upcoming year, come 2021, we're going to be applying for a renewal on our federal funding for the California Stroke Registry. I'm also talking to the EMSA, the Emergency Management Services Authority for the state. Dr. Dave Duncan is an ER doc who is overseeing the whole system, and I'm talking with his team because he's got some real innovations in terms of health information exchange going on in response to COVID that really links even pharmacy to electronic health records. And we're going to try to do more with this, not only for emergency, but for maybe for the work we're trying to do in chronic disease. So please understand that those conversations will also begin in October. And then finally, really looking to do more in this distance process telehealth. It's hard because it isn't reimbursed at the same level. I want to just share with you as we close some real challenges that we have at the state, including funding. Even now, the federal government can't figure out a renewal of the federal funding. They're still debating the issue in terms of stimulus, and we're not really even in the worst of it. We predict that the winter is going to be very tough on everyone. And so I want to also, again, thank you from the bottom of my heart and tell you to stick together. It is only by coming together, working together, maintaining the safety practices to keep you well. You are the most important and valuable across the state to keep this population well. We will, in all likelihood, look to you to leverage vaccine rollout when it comes, medication should those be developed, You are constantly being asked to do more with less, and I can relate, but I'm not doing it on the ground. You are. So again, I'm completely honored to be with you today. I am here as a resource. You all, as I had met with many of you last year, September, you know you're close to my heart, and I do anything to support you, because what you have done to save lives cannot be underestimated. And I know you don't get credit enough. And I do intend in the coming year to promote your work, as I've done for a few years now, and looking forward to any questions or thoughts again following this meeting and into the future. Let me now pass the controls over to Stephen to take it from there. Thank you.
Thank you so much, Dr. Nunez de Ybarra. Again, I hope everyone understands why she's part of this keynote. Whenever I speak to her, I am just in awe of all the things that she's responsible for and how she coordinates her team to make substantive changes for the patients that need it the most. And you know, her endorsement, look, I've known you for a long time now. There's never been one lapse in your commitment to the support of pharmacists and the work that they do, and for comprehensive medication management. So you made some very bold offers, commitments today. I know you. I know that those are not just words. Those are real commitments. So thank you. And we all look forward to continuing to work closely with the Chronic Disease Control Branch and your wonderful team. Now, I think at this point, we are going to share some reflection questions, and I believe they're going to come on screen in a minute. Let me see. We did send them in the chat as well. We're going to do another quick breakout because we just heard some amazing commitments, needs at the Chronic Disease Control Branch, and a lot of alignment with the work of this collaborative. So these are your two questions for the breakout. What did you hear that you found exciting or surprising? And then what can you or your organization offer or adapt that aligns with the priorities of the California Department of Public Health Chronic Disease Control Branch? So we will do a 4 or 5 minute breakout, come back, share, and then move on to our next speaker. Let's enter the breakout now. Again, assign somebody to record, please. And I think we're going to launch soon. Okay, and just so you know, the questions are also in the chat if you need to pull them up. There's a Word document shared. And here we go.
Hello, am I in a classroom?
Okay.
Hello.
Hello, how are you?
How are you? I'm doing fine.
Good, thanks.
Yeah. So what do
So
you do?
just-
Yeah, sorry.
Just to
I'm a
let you
pharmacist
know.
oh, I'm sorry. Go ahead.
Diane, go ahead.
I'm sorry. Are everyone? Yeah, a lot of people are still, I think, transitioning to breakout rooms. So we still have about 30 participants that aren't in breakout rooms right now.
So right now, some of us are in the main room, and there should have been a pop-up
Pop window
screen
to join.
where you have to
Yeah.
manually push join to go to your room. And you
I
should see
didn't
only
have a
about
pop-up.
3 to 5 people in there.
Mario, can you put them in breakout rooms? Okay.